Number 4, deep fascial release or Travell deep stroking. We're going to use our Myobar APL bar. The benefit of this tool on this stroke is for treating longer areas or just bigger areas of anatomy. When you have a lot of ground to cover, the bar is extremely helpful versus your hands, especially in terms of fatigue. When you have a session, half an hour, 45 minutes, maybe if you're working on even a larger patient for a shorter section, working around the entire thigh, leg compartment is, it's very, very time consuming and it's very exhaustive. So the bar work is going to help with that. Deep fascial release is based on the rationale of the Rolfers or structural integrationists, such as Finley or Myers, look to their work. And also, Travell and Simons originally in their text talk about deep stroking massage and the breaking up or dissolution of fragile myofibrils. So for those of you out there that want rationale, there's some things to look at. In terms of technique, this bar is really helpful with that notch because it will track. Okay, so I can start all the way up here in the trochanter, greater trochanter, and I can come down. This is really, really easy for me. And if I get over an area that might be a little bit sensitive, I can ease up my pressure. And I can go all the way down in the meat, put more pressure in the meat. And as I get down into the foot ankle, I can lighten up pressure. Okay? So this is more of just skin I'm working. Okay, when I get into the lateral leg compartment, I can press deeper. When I come over the lateral knee, I'm going to lighten up. And I'm going to pull all the way to the greater trochanter. So in such a way, I just did this. I'm treating this entire area, and I'm getting the pull, the fascial pull, coming all the way through. So from this all the way down. Okay, so some massage strokes you do are kind of slow, but this you can definitely get the forces going through the tissues. The other benefit here now is that we can work around an area. So we did our stroke, say, in the lateral leg. Now we can work around into more posterior fibers of the hamstrings, into the calf. Here's an example where that trimmed accessory handle comes in handy. I can switch that tool because I was getting close to bumping the foot in the table. So I can turn that. And I can also move the tool and use this part of the bar. And get all the way around into the hamstrings. Okay. If I want to do the quads, turn the tool again. And I can do long strokes all the way through. The olecranon again is for deep, your kind of deepest strokes. So you can see what that does there. That's going to really focus the deep tissue stroke in there. So if I find a meaty part of muscle with a fibrous tissue restriction or density, I can focus in on that with the bar in the middle of my stroke. I can keep going, lifting up again. And here, working in with that olecranon to focus my treatment. We've been at this for about 2 minutes. If you did this treatment for 5 to 7 minutes with this bar, you get around almost the entire leg in this posture. Maybe have the patient turn to a different position for the medial part of the leg, but you can really get around. You can get into the glutes and the hip, anterior hip. Yeah, really nice tool, real time saver, really effective, efficient.